All right, welcome to Minecraft and also learning paramedic NREMT questions. My goal today is to build a house. I don't really know what a house looks like. Apparently, house. Nope, I don't want house. Yes, here we go. Here we go. Beautiful, beautiful. Hey, I like that. Look at that. That's pretty nice. So it looks like you got brick and then wood for the actual roof, and then some substance for the accents and the lining. So maybe we'll do that. But first, let's kind of cut a question, man. 48-year-old male fell 12 feet off a scaffold onto his left side 10 minutes ago. I bet you he's going to have a fucking tension pneumo. Yeah, his breathing is absent breath sounds on the left, right side clear, hyperresonant percussion on the left, visible segment of the left interlateral chest moving. He has a flail segment and a tension pneumothorax. Pulse is 120 and weak, low blood pressure because of the obstructive shocks or bleeding. Who knows? No external hemorrhage. It does skin is cool and pale, so he could be bleeding. Trachea midline, no jugular venous distension, and so we are not going to call this cardiac tamponade. GCS is 14, anxious but oriented, high flow O2 with non-rebreather, 214 gauges established, no fluid started. Transport time is 25 minutes. Apply bulky dressing to the splint, flow segment, begin assisted ventilations. Perform needle decompression of the left chest at the safe zone with a 14 gauge. Yeah, we're going to do that. I'm not even going to look at the other ones. B, because he's having a tension pneumo. So let's get back to Minecraft while it thinks about that, which is how I plan on doing this. I mean, if you look at how just back-asswards my idea of a house is, look at the way I build. It doesn't make a whole lot of sense. So one thing we have to do in preparation for the supply demands that are about to come is to get just a bunch of stone axes. I don't have a lot of stone or brick. I haven't gone so far as to get deep slate yet. And so as far as the sort of brickwork around it, I've got some cobblestone stairs that'll be fun. Sorry, the townspeople are begging me for this house. I'm about to start hitting them because, come on. Cherry fence. I don't really need a fence for these people. We'll give them a spruce door. Alright, let's get to building. If y'all close the door on me, I'll kill you. Okay. Alright, B. The constellation of absent breath sounds, hyperresonant, tachycardia and hypotension is classic for a developing tension pneumo. Tracheal deviation, JVD are late signs and may be absent when circulating volume is low. The tension pneumo kills by obstructing venous return and collapsing the lung. ATLS, TCCC, and civilian EMS guidelines all direct immediate needle thoracostomy as the first action once it is suspected before positive pressure, ventilation, or fluid resus. Okay, you wouldn't do the bulky dressing in BVM because stabilizing the flail segment and adding PEEP help ventilation only after the tension pneumo is relieved. Backing with PEEP before decompression can worsen the tension. It can. You can just be pumping air into the pleural space. 500 milliliters of crystalloid volume alone cannot overcome the mechanical obstruction of venous return caused by trapping intrathoracic air. That's correct. BVM without PEEP, deferred chest intervention, provides oxygen but leaves the lethal internal pressure unchecked. Even gentle positive pressure ventilation can tip a simple pneumo into full tension. Practical pearls is that hyperresonance plus unilateral silence is decompressed now. Don't wait for tracheal shift. That is a late sign. Site matters. The fifth intercostal space AAL with a long needle or second ICS midclavicular are both acceptable per current evidence. Choose the one that you can hit fastest and deepest. Treat flail chest next. Once tension is relieved and vitals start to recover, apply bulky dressings or binders and continue analgesia, gentle PEEP or CPAP. Keep sharpening that diagnostic eye. Thanks, buddy. Another. Okay, back here. Let's build him a house. I guess we can build it. Diamond shovel. We'll build it here, I guess. Let's lay out the plot. I'm going to dig into this hill a little bit. Hey, buddy, you guys Yeah, just let that kid run around. Look, there's bones. This is a violent place. It truly does become a violent place here at night. I swear if that kid gets in the way, I'm going to put him in it. There's caves. There's open cave systems here. And that child is just running around. Crazy stuff. Let's get a little bit more of this. Dun, dun, dun. What do you think the next question's going to be? I think it's going to be... It'll be a trauma. No, this one was just a trauma. Sorry, I'm being ambitious right now. Okay, so the house can go... It doesn't have to be big, but it can come right here. This takes about a stack of material. Each one of these takes a stack or two of material. I've got a bunch, but did I leave a crafting table over here? So yes, there's one in this house, thank goodness. Not that I super duper need one right now. But let's start with just a stack of that. Let's see where we go from there. So I'm just going to make this one wooden. I'm not going to give it the fancy stone stuff. I might give it... I do have a stone cutter. Maybe it'll do stone cutter stuff with... They're just hopping onto this saw. Nah, it doesn't really do much. Ooh, you know what I can do? I forgot. I have sort of like infinite fuel. I forgot that's a thing I have. So check this out. First off, let's look at the question. A 32-year-old female is found unconscious next to several empty tricyclic antidepressant blister packs, amitriptyline. During transport, she has a 45-second generalized tonic-clonic seizure that terminates spontaneously. The current assessment is that she has a patent airway. Her gag reflex is intact. She's got regular breathing. It's shallow. Not regular. It's regular rate, but it's shallow. SpO2 is 95% on non-rebreather. She's got a high heart rate, low blood pressure, skin pale, and mottled. Her forelead says sinus tach with wide QRS and prominent R waves in AVR. Her pupils are 6 millimeters. They're kind of dilated and they're sluggish. And her blood glucose is normal. She's going to get sodium bicarb. That's the easy answer here. Sodium bicarb is kind of the thingamajig for tricyclic antidepressants because it disrupts part of that cycle. Give me my pumpkins. Okay, let's, oh yeah, we're getting the infinite fuel. Isn't that cool? It just refills. So now what I can do is come over here. Get out of my house, y'all. That's why I'm having to build them houses at a crazy rate. They do not care. And we're just going to make stone with that. In the meantime, in place of the stone that we're going to put, we'll just put dirt. We'll use that as a placeholder. Let's cut the grass here real quick. Okay, so this will also help me just make a... Sorry, I thought I saw a creeper. Okay, that's pretty cool. Put the door down. Oops. All right. Sorry, got a little crazy there. This mountain can serve as natural scaffolding, which is nice. No, no, get, don't, no, 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 no. Shnikes, get off, get off. Get off. Thank you. Goodness. Crazy fella. He's crazy. Now I have to make my own scaffolding because that dude is trying to... Don't look at me like that. Dude's crazy. Am I making the ceilings too high? I actually think I might be, but that's okay. It's extravagant. And so check this out. What I'm actually going to end up doing, I think, is replacing this entire... Okay, bud. Do you have anything cool? No, you have the worst deals. I made a terrible villager. He is not a great dude. What I'm going to end up doing in these corners is just putting the spruce logs, I believe. Alright, we ready for the next question? I know my answer was right. Correct. The wide QRS is a marker of sodium channel blockade, so that's why you give the sodium bicarbonate. Predicts a seizure because it lowers that threshold and ventricular dysrhythmias. Prominent R wave is a classic ECG sign of cardiotoxicity with tricyclic antidepressants. Hypotension and tachyarrhythmias are caused by impaired myocardial contractility and peripheral vasodilation, which also causes that awesome mottled skin with pale stuff. Hypertonic sodium bicarbonate bolus raises serum pH alkalinity and increases extracellular sodium, which overcomes the drug-induced sodium channel blockade, narrowing the QRS and stabilizing the myocardium. It improves blood pressure and reduces the risk of malignant ventricular rhythms. It can be repeated if the QRS widens again or hypotension persists. Titrate to the pH, which can't really do pre-hospital unless you're really cool. Why the other options are not appropriate: lorazepam, benzodiazepines treat active seizures or agitation. Magsulf is used for torsades, and amiodarone is an antiarrhythmic with additional sodium blocking properties. That's real bad. My hand keeps sticking to this textbook. While it's thinking of another, let's go ahead and we'll test the disgusting. What has happened? What have I done? That is a horrible mistake. I am to be executed immediately. I accidentally put the log oriented wrongly. Now it's oriented rightly. It doesn't super make sense to have the one block at the bottom. Yeah, that looks good. We'll just knock out the bottom blocks. Get out of my construction zone, please. I'm making you guys a house. How's that look? It looks okay. Is it just the same thing as this? A little bit. Okay, enough of that. Stone should be ready now. 20. No, I need more than that. Let's go ahead and see what we can make here. Should I do bricks? Chisel? Hey, let's do chisel. Let's make it fancy for these people. That is fancy. I like that. There goes my terrible villager, who doesn't have anything good to sell. Oh, forgot this one. Okay, that was enough. That's kind of neat. It's just... Oh, that's creepy. I'm so glad I made a very creepy doorway. That's not as creepy, still kind of weird. Very strange. I guess it needs a floor now, huh? And I haven't made any of the beds. Alright, y'all. Well, At least give it some ambiance. And I guess we'll give y'all a roof. Good, I'm just placing them wherever I want. Right here in the... Okay. Alright, we'll work on the floor tomorrow. Are we ready for the next question? 2 babies. I'm raising 2 small baby children. I'm going to make the pink bed now. Why can't I make the pink? Oh, I don't have space? No, I do. Let me dump the sweet potato, apparently. Wrong chest. Here's what we're actually going to do. Good night. I'm not taking the kids out of the bed. Okay, 29-year-old construction workers trapped beneath a collapsed concrete wall, extricated approximately 2 hours, and is now on your stretcher. He's obviously got a fucking positional asphyxia and all that good stuff, and crushed everything. Patent airways speaking, but anxious. 26 breaths per minute, equal bilateral breath sounds, 97 on room air. High pulse, low blood pressure, skin cool and moist. Left eye visibly swollen, tense, and ecchymotic. Distal pulse is present. None of that's great. Pain is 9 out of 10 in the left leg. Narrow QRS, tall peaked T waves across all leads. Does he have high potassium? Is that what's going on? His leg is just spilling waste products into his body or something. Give me some fucking calcium, dude. Is it calcium that he needs? Let's go ahead and say it's calcium. If not, we got to do something silly. It might not be. I want to make an overhang here, but I'll do that with the stone. We got to figure out the floor. Get out of here. That should be enough. All right, y'all. Oh, that's awkward. Now it's less awkward. Okay. Well, we'll just do this. Hey, that was close. You almost lost your life. You're almost down there forever, bud. And you're making me mad still. Yeah, get out of here, dude. Next question, I guarantee, is going to be it's going to be like a typical, I bet it's going to be respiratory. Okay, well, y'all got another house now with, let's put 2 beds down in it. Okay, and I guess we'll give you a crafting table. I hear a cat. We'll give him a chest as well. Be kind of cool. Alright. Welcome to the jungle. You're gonna die. Cool. Isn't that fun, you guys? Another house. Look, small baby is already going into... Oh my goodness! What? They just run through the... Oh my... They use it as a racetrack. They just... Oh, they're crazy. I have really made something special here. My farm, my tree farm, my pumpkin farm, my fish farm, my lava pit. It's all natural stuff that's in a good town. Right? It's normal, I think. Let's make some bricks. Bricks. Thank you. And now we'll go and cut more logs, I guess. Alright. Correct. Give calcium. Hyperkalemia from massive potassium release from crush injury, prolonged limb compression. Calcium chloride immediately stabilizes the cardiac cell membranes. Thank you. Okay, you wouldn't give saline because reasons. Morphine is great, and sodium bicarb is not the answer either. You would give crush syndrome, give calcium chloride fluids, and maybe some bicarb or nebulized albuterol to displace some of that potassium, and then analgesia. Another, please. So many village. Let's look at it. Let's look at our floor plan here from up above. Not high enough. Let's just get to the top of this thing. Okay. Little secondary tree farm over there. The ocean over yonder. More woods and a river over that way. Plenty of iron golems. I think I count two. Two? I kind of want more than that. I guess I should repair them. And everyone seems to be having fun. Not everybody has a job, but what a cool little village. Ow! Don't mind me jumping to my death repeatedly. Don't worry. I have removed myself of 50% of my capacitance, just for the sake of going up that hill. Alright, well, if somebody wants that bed, they're gonna have to sleep right next to their buddy. I like that he sells those iron axes, my favorite. Actually, I should have just done that. I already have one, actually. Alright. Plunking time. Then we'll go do that other question. "30-year-old female delivered a healthy infant 30 minutes ago. He's alert but anxious, complains of dizziness." Oh, the baby doesn't, the woman does. Heavy vaginal bleeding, linen soaked, estimated 800 milliliter blood loss so far. Uterus feels boggy and enlarged on palpation. Placenta delivered intact. Low blood pressure, high heart rate, high respiratory rate, and regular SpO2. Skin is cool, pale, and moist. Too large for IVs with high flow O2. Manual uterine massage indicated. According to current pre-hospital guidelines for postpartum hemorrhage, which medication should you administer next to address the most immediate threat? Brother, she's fucking TXA, dude. She's bleeding. Okay, let's chop down big tree. It's always fun. I say TXA because the uterus feels enlarged. It feels like blood. It feels boggy. I don't really know what boggy feels like. I have a feeling I know what it feels like, but I would suspect internal hemorrhage, especially with the vital signs and the blood loss, heavy vaginal bleeding. Okay, let's look at the answer. Correct answer is A. I was wrong. Oxytocin. The boggy enlarged uterus tells you that this is uterine atony, a leading cause of primary postpartum hemorrhage. International guidelines list oxytocin 10 IU intramuscularly, or 20 in 1 liter of fluid for an IV infusion as the first line uterotonic to make the uterus contract and clamp maternal vessels. Oh, that's really interesting. A uterus not wanting to contract would stop the body's natural reaction to hemorrhage. Give it immediately while bimanual massage continues and large bore lines are readied for fluids and blood products. Interesting. Okay, antifibrinolytic that reduces mortality when added within 3 hours of birth. It supplements but does not replace a uterotonic. Give right after oxytocin if the bleeding is over 500. So I wasn't wrong, but I'm going to be honest, I didn't know about uterine atony or the role of oxytocin. I don't know if I said before, but I am punching up with these questions. Okay, practical algorithm, blah, 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 blah. Okay. Well, I didn't know about oxytocin's role in that. By repeatedly just asking ChatGPT to give me another and not really specifying what, I am probably accidentally putting it down like a logic rabbit hole in which the questions are going to start just getting weird or needlessly niche. And I'm not saying that niche has no role in education, but I'm saying that ChatGPT is going to be trying to give me gotcha questions, which is okay, because would I rather have the obvious answer questions or a gotcha question? And I might want a gotcha question. Sorry, I'm trying to get my groove back here. There it is. Now I got my groove back. Kind of, not really. All right. Now, as soon as all this clears out, that'll grow. Okay. I got that one wrong, and so I do have to do something now. I have to pick the number 160. So we have to go to page 160, and we have to read it. Okay, so it's just the beginning page of Chapter 6, Health, Maintenance, and Screening. The concept of preventative care. Advances in preventative care in the past 50 years have resulted in a tremendous decline in the incidence of debilitating common illnesses. Okay, so it's good. It's great. Preventative care has done a good thing. It's caused a decline in debilitating common illnesses. Increasing knowledge and acceptance of health maintenance and disease prevention measures by patients have greatly facilitated and improved healthcare delivery by clinicians. As you proceed through your training, you will soon realize that many clinical conditions are largely preventable. Counseling your patients to eat a healthy diet, to exercise regularly, avoid tobacco, and to receive preventative services such as cancer screenings, preventative visits, and vaccinations are just a few examples of ways you can help them maintain and promote their overall health and well-being. The promotion of health in the world, as the World Health Organization has stated, enables patients to increase their control over and improve their health. Isn't that great? So we got an easy one. Page 160 wasn't bad, but what a nice little excerpt on preventative health. Anyway, a 46-year-old male crashed his motorcycle at highway speeds and was thrown onto the median. Assessment reveals he's got a patent airway. He answers questions appropriately. Breathing kind of fast. Equal bilateral breath sounds. Good SpO2. His blood pressure is low. His pulse is low. Skin is warm and dry. Flesh below the clavicles. Neck veins flat. This is gonna be fucking. Yeah, this is gonna be. What is it? Blah, 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 blah. GCS is 15 pupils. His pupils are equal. Loss of motor and sensory functions below the nipples. T4 level, no external bleeding. Deformity noted to mid-cervical spine. Full spinal precautions in place. 2 18 gauges are. Transport time is 20 minutes. According to current guidelines, which intervention should you perform next to address the patient's most immediate physiological problem? Well, his immediate physiological problem is kind of the question here, isn't it? 78/40, pulse is 46, is neurological, it feels like. Administer 0.5 milligrams atropine. I don't think so. Infuse crystalloids. I do want to infuse crystalloids. He's obviously having a neurological problem that is right around where his heart is at, and so them heart nerves might not be getting nervy enough. Atropine might not work here. Start a NREMT infusion. Yeah, it could be. I do want that blood pressure up. It also could be crystalloid fluid bolus for the same reason. I do want to avoid hypotension with the possibility of neurological. He's got a high GCS. I hope the NREMT was the right answer. I just want to get him to. No, because the vasoconstriction is going to make his heart work harder, and I feel like it's a conduction issue. Give me the saplings. Give me them now. Correct. C. Stort and REP. Why? Because it's hypotension with bradycardia, warm flesh skin below the lesion, and complete motor sensory loss are classic for neurogenic shock from high cervical thoracic cord injury. Neurogenic shock is distributive. Loss of sympathetic tone causes severe vasodilation and relative hypovolemia. Current trauma and SCI reviews recommend early vasopressor support, NREMT. Okay, because it provides alpha vasoconstriction and beta-1 chronotropy to correct both low SVR and bradycardia, low systemic vascular resistance. A modest bolus can precede pressors, but fluid alone rarely overcomes profound vasoplegia and may worsen cord edema. Atropine can raise heart rate but does nothing for the vasodilation. High flow oxygen is appropriate but does not address the circulatory collapse. Okay. Please, Janet, we'll just ask the question again so that hopefully we avoid what I was talking about before. A paramedic level NREMT exam question. It keeps giving me scenarios, and I don't think that's really accurate to how the exam is. The fields are almost ready for tending. I like the birch tree that's just up there on the hill. Maybe that's what this will be. Birch Tree Hill Estates. Wow. Birch Tree Hill Pumpkin Estates. Birch Tree Pumpkin Iron Golem Fish Farm Estates. Lava. Many villagers with intrusive baby estates. Sounds good. Okay. 42-year-old woman is found unresponsive on her living room floor. Beside her is an empty 100-tablet bottle of propanolol. She responds only to painful stimuli. Her airway is patent with a present gag reflex. 10 breaths a minute, shallow, with SpO2 90% on room air. Low heart rate, low blood pressure, skin cool and clammy. These people are always in shock. Dang. We can't just have a regular patient with like a little problem. They're always in shock. Sinus Brady with first degree AV block. 3 millimeters. Sluggish with regular blood glucose. High flow oxygen has been applied. The large bore IV lines are in place. Why do they do that? They throw in dual 18s. I mean, they are in shock. Which pharmacological intervention is the most appropriate next? Well, propanolol. We could give sodium bicarb, right? I don't know anything about propanolol. I'm going to be totally honest with you. We could give sodium bicarb in the case that propanolol is a sodium channel blocker. We could try atropine. We could try pacing. I'm going to do something crazy. I don't know that sodium bicarb would work. I hope that doesn't make anything worse. The pacing sounds like a good idea. D, we're going to get it wrong. We're about to have to read a page out of this book. I can already tell. Give to me more saplings. Maybe I should go fishing. I should get some fish. I need more food. It might end up being fish. We'll do some night fishing. We'll do that. Hey guys. I wonder if you can feed the fish. It'd be kind of cool. They should make that, where you can feed your fishies and name them and make a fish tank. Give me a fish. Alright, correct answer was C, give glucagon. Why? Because glucagon is the first line in a beta blocker overdose. We're learning so many things. First it was uterine atony, and now we're learning that glucagon is the first line in a beta blocker overdose. Isn't that super important? I gave sodium bicarb. Well, it is a sodium channel blocker. I wasn't wrong, but it's also a beta blocker. Glucagon is first line, however. Glucagon acts on its own receptor, GS protein, increasing intracellular camp in cardiac cells independent of beta adrenergic pathways, thereby improving heart rate, contractility, and blood pressure. Current toxicity and pre-hospital protocols list high-dose glucagon as the antidote of choice for symptomatic beta blocker overdose. Glucagon. Adult dosing is 5 to 10 milligrams IV bolus. Repeat once needed, then an infusion titrated to effect. Vomiting is common. Protect the airway. Why sodium bicarb is adjunctive and not primary. While propanolol can widen the QRS via sodium channel blockade, sodium bicarb is indeed indicated if ventricular conduction delays or dysrhythmia persist after glucagon, but glucagon is the first line. It does not reliably reverse the profound bradycardia and hypotension that kill first. And so it's about doing the best thing first, or the most evidence-based solution before, you want to give the patient the best shot, not just throw something random out there. Okay, atropine is often ineffective in beta blocker toxicity. Any benefit is transient. Transcutaneous pacing may be attempted if all else fails. Electrical capture without pharmacologic support is frequently poor. I was just thinking, like, you can force the heart to beat, but if the chemicals aren't there, it's not really going to work, huh? Sodium bicarb IV push is helpful for a wide QRS, yet it will not raise cardiac output like glucagon. Give after antidote if QRS remains wide or arrhythmias develop. Yeah, alright, glucagon. We'll just say another. Here comes one. Yeah, salmon. We are fishing. Just thinking about how I was wrong. I saw glucagon. I was like, no, the blood glucose is fine. Why would I need to break up that glycogen? Hey, give me a stick. Here we go. Once all those leaves are done, I'll throw some bone meal in here. We'll be able to grow a new tree. I should probably light the rest of this property and build up and around and put little buildings just to give it some shape and depth. I have not done that yet. Oh goodness, what is over there? Actually, I'm going to make sure nobody dies, so I'm going to go to sleep. These iron golems keep getting hit by stuff. Okay, one of the babies left. How did I make the advancement tactical fishing? What even is that? Husbandry? What does that even... Oh. Well, that's interesting. Where's tactical fishing at? Okay, here we go. Is it because I jumped while fishing? Is that a thing? Goodness, looking at all this, I'm like, what? Kill a breeze with a deflected breeze shot, wind charge. I don't even know how you would even begin that. Is it here? Yeah, I'll be honest, dude. I don't even know where to find the achievement I just got. Okay. Tactical fishing. There was like a cat over there chasing a skeleton and I got nervous. I don't want the cat to get attacked. I think it was a cat. I couldn't really see exactly what it was. Thank you. Alright. Oh, they did it themselves. That's ginormous. I don't know if the last one was that tall. Goodness, I'm never going to run out of wood. Okay, new adventure. Here in a second, I'm going to go ahead and say I've got the shears with me. Good, okay. So we'll go ahead and get shears. And then we'll build another house with more beds. Honestly, I'm gonna make a long house this time. Look at all these. I guess I can put windows, huh, so the babies can get in here. There you go. A house. Can't believe. Can't believe that the tree is humongous. All right. A 66-year-old man with a history of hypertension and prior anterior MI suddenly developed severe dyspnea while watching TV. On EMS arrival, sitting upright, gasping, coughing, pink, frothy, spewing, he has emphysema. No. He's got two-word sentences, 34 times a minute breathing, labored, accessory muscle use. SpO2 is 86% on room air, high blood pressure. Pulse is 124 and regular, skin cool and diaphoretic, diffuse bilateral crackles up to the mid-scapula. Sinus stack, no ST segment elevation, lisinopril, metoprolol, furosemide daily. Okay. Chicken nuggets, chicken nuggets, chicken nuggets. Is this flash edema? Or just pulmonary edema in general? Pulmonary hypertension. High flow O2 by non-rebreather is in place. The patient is being coached to keep the mask on. According to current pre-hospital evidence guideline, which intervention should you perform next? Administer more furosemide and prepare for a second dose. Begin CPAP. While preparing nitroglycerin, did we take a blood pressure? Yeah, we sure did. Give 2 milligrams morphine IV slow push. Start a saline bolus to improve organ perfusion before applying positive pressure. Brother, I think he's got organ perfusion down pat. Begin CPAP. Sounds pretty good to me. Furosemide's great, but he takes Lasix. And so, like, yeah, I'll probably push a little furosemide maybe afterwards, but for right now, that brother needs CPAP. Let's find out if we killed him or not. There's a good chance we did. Do I want to... do I just want to get this fella out of here? Let's do it. Let's do it. So, you know, he's already in possible fluid overload. You know, why would you just shoot him with a bolus? Now, it's only 250, but that's still 250. I understand starting a line, but just throwing a crystalloid bolus in there seems like it's kind of hardly ever the answer in most things, unless they're just like profoundly dehydrated or hypovolemic for any other reason. But you got to be careful just administering straight fluids. I'm really curious to see if I got that right. I hope I did. I could see furosemide helping, but if he takes it, now let's say he's not compliant, you know, it would help him in the long run, but as far as right now, did it tell me how long the transport time is? Because it could help, I guess, but... Making my way downtown. When I get to the top of this, we'll look at the answer. Okay. Time for the answer. Correct. Begin CPAP while you ready sublingual nitroglycerin. Flash pulmonary edema from a hypertensive surge is filling the alveoli with fluid and increasing the work of breathing. NIPPV and CPAP recruits the flooded alveoli, improves oxygenation, and by raising intrathoracic pressure, reduces both preload and afterload, letting the failing left ventricle eject against a lower pressure. This quickly relieves dyspnea and can avert intubation, which increases their chances of survival. Systolic blood pressure of over 200 drives fluid across the pulmonary capillaries. High-dose nitro vasodilates, dropping that afterload even further. Modern escape protocols pair NIPPV with aggressive nitrates first and de-emphasize loop diuretics in the hyperacute phase, which is what I was talking about. Furosemide, diuresis from furosemide takes 30 to 60 minutes. May harm patients who are vasoconstricted but not volume overloaded. Evidence suggests no mortality or intubation benefit in the first hour compared with nitrates and CPAP. Morphine can worsen respiratory distress and has fallen out of favor. Saline bolus, extra volume is contraindicated, and it raises pulmonary capillary pressures and will exacerbate edema. Fantastic. Another slams fork and knife on table. I'm going to be quirky. I wonder if it's going to get quirky back. Alright. I'm glad we got that one right. Glad we weren't killing people. Okay, here we go. Ooh. We're a little too high up to be moving that fast. Hey, what is he doing out there? What are you doing to those cows out there, man? Leave them alone. Look at my wonderful home. I guess I could branch out. That's kind of what I wanted to do. So far I've branched in. But I could certainly do some branching out, I guess. Oh, that scared me. Jeez Louise. I didn't mean to do that. I was trying to find my feng shui. There it is. We've got it. We've got the feng shui. Oh, only 2 saplings so far? It's kind of not all the saplings that I was expecting. Oh, so why are these here? Hey, come on, man. I'm gonna need a couple more than that. Need more saplings than that, my man. There's not a lot of leaves on that tree, I guess. I don't want to have to go get more. Well, I guess I could have as many spruce saplings as I want. These things drop crazy saplings. I guess I don't really have to worry about it then. There we go. There we go. There we go. Alright, let's talk about this. 28-year-old woman, 32 weeks pregnant, suddenly develops a generalized tonic-clonic seizure. Oh my goodness, are you just... What is she? What is she having? Uteranatomy? She's got a high blood pressure, high pulse, skin flushed and moist, no focal deficits. Her breathing is shallow, 94% on room air. Intact gag reflex with a patent airway, no focal deficits, confused but arousable. You can get her to sort of look at you and stuff. She's in a postictal state. No known epilepsy, denies drug use. This is, what do you call it? Could be eclampsia. She's 32 weeks pregnant, 45 seconds while shopping. High flow 2 is applied. What do I give her? Mag sulfate? Yeah, I think so. That's a high blood pressure. What about that labetalol? She's no longer seizing. Isn't it mag sulfate that you give her? Man, I gotta be honest with you. Not doing too hot on this one. I like labetalol for low blood pressure. Because 184 is real high. And she's obviously got capillary not good stuff. That's the most immediate physiological threat to me. Let's think about it while I get saplings. Labetalol to lower the blood pressure. You're about to hear an idiot talk about this, by the way. It seems like a pretty sledgehammer fix, whereas there's obviously something causing this high blood pressure and something causing that seizure that's potentially related to her pregnancy. Do we know if she has a history of seizures? Is this something she's diagnosed with prior to her pregnancy? Am I just going to go ahead and give mag sulfate? I wish I could Google it, but I told myself I wouldn't. We're going to go risk it for the biscuit A. We're going to give her magnesium sulfate. I hope that doesn't kill her. You should know about these things, right? But I want to learn about them, so this is how I'm learning about them. Yeah, there we go. I'm going to wait till all those leaves go before I... No, actually I'm not waiting till all leaves go. I'm about to break the bank for this dude. Go ahead and give me 10 emeralds, my man. Oh, oops. Thank you. Now he'll be an expert soon. 10 emeralds, what do I spend them on? Who's got something for me to purchase? You want me to buy more buckets of cod, huh? I don't need that many buckets. And I can't buy anything. Is anyone using this? Hello, other farmer. Yeah, you just want stuff from me as well. You don't even have a job. What do I make, an emerald block to show my stature? Is that what I do? Okay, he can make some, give me some bricks. Get bread from him. I would like an iron sword with knockback, but you know what I need right now? I need an axe. Where's the, okay, come on, where's the... Just give me the rested bricks, man. There you go. Take that, and he's going to level up as well. I don't even know what you do with bricks. I just have so many now. There. Set my spawn point. Has our tree grown yet? No. Please. Okay, mag sulfate. The presentation of over 20 weeks pregnant, seizure, severe hypertension, fits eclampsia. Mag sulfate is the evidence-based first-line therapy. A 46-gram IV loading dose over 10 to 15 minutes rapidly stabilizes the cerebral and neuromuscular irritability that drives eclamptic seizures and also reduces the risk of recurrence. I knew that. After the loading dose, a maintenance infusion is continued en route or at the receiving facility. Midazolam stops active seizures. The seizure has ended. Labetalol controls severe hypertension. It's important, but blood pressure control follows magnesium administration. Start antihypertensive once the airway is secured and magnesium is infusing. Target systolic over targeting a systolic under 160 millimeters of mercury and diastolic under 105. There's no indication for sodium bicarb. Okay. Another. I like that it gave me an OB question. That's pretty cool. I had read about eclampsia, and that's how I knew mag sulfate. Let's go ahead and make some bone meal. Bone meal will help that next tree grow. What am I doing here? Where am I? I'm looking. Bone meal, that's what I was doing. Okay, we've got pumpkin. Alright, pumpkins, into the chute you go. I'll get one bone meal from this watch. Yay! Okay. Alright, and that leaf should be still there. Okay, great. Still there. Alright. Well, it'll grow by the time I get back, I guess. Watch, the baby is going to jump right back in that bed. A 55-year-old man is found unresponsive next to an empty pill bottle for metoprolol. Guess what it's going to be? It's going to be fucking glucagon, dude. It's going to be glucagon. Oh, they already gave glucagon. Oh, this one is tough. Shit. A 55-year-old man is... Wait. I said slams fork on knife and table. It did not respond at all to that. Wow. Okay. 55-year-old man. He's unresponsive next to his extended-release diltiazem and metoprolol. I'm going to be honest. I know a little bit about diltiazem. I don't know a lot. Airway. He's got snoring, respirations, low frequency, low SpO2, and non-rebreather. He needs a fucking head tilt chin lift, buddy. He's got a junctional rhythm of 34 with low blood pressure. Wide QRS, no ST elevation, low GCS, kind of high blood sugar. They've already given him oxygen, already started the large bore, given him atropine, no change, given him glucagon, brought his heart rate to 38 from what? No blood pressure change. Okay, the glucagon is probably why his blood sugar is a little high. Calcium chloride, 1 gram, no change, and norepi map is still under 60. Transport time to a cardiac capable center is 25 minutes, according to current tox guidelines. Which therapy should you initiate? Brother, we ain't given the one thing. Well, sodium bicarb. If this is a sodium channel blockade, high dose insulin euglycemia therapy, could be lipid emulsion therapy of intralipid IV bolus. Brother, I don't think we've got a fucking intralipid IV bolus. What the hell? Transvenous pacing via field pacing catheter. I don't think we have that. What do you think we have? We got sodium bicarb, baby. Go ahead and try and beat back some of that sodium channel blockade. I'm going to shear you. He didn't like that. I'll be honest, I don't see a lot of sheep around lately. Oh, catch a fish without a fishing rod. Oh, because I used a bucket. Okay, well, let's eat a baked potato. And go scalping. No sheepers over here. What about over here? You guys got sheep? No, what happened to all the sheep? I can't shear a pig. Guess we'll go up the hill. The correct answer was A. Initiate high-dose insulin euglycemia therapy. This thing thinks I'm a... Okay, maybe that is a national paramedic thing. High-dose insulin is the critical next step. The key clues are the mixed beta blocker and diltiazem, dual negative inotropy and chronotropy, profound cardiogenic shock, calcium channel blocker and the beta blocker. Okay. Still hypotensive bradycardic after atropine, glucagon, calcium, and norepi. All antidotes have failed. Needs second-line therapy. Can be due to drug-induced sodium channel blockade, but the life threat is pump failure and vasoplegia. Okay, so the insulin therapy markedly improves inotropy and peripheral utilization of glucose, restoring cardiac output even when the pressors and glucagon don't work. Large case series and guideline reviews now place HIE as the recommended escalation for beta blocker or calcium channel blocker that is refractory to first-line measures. Interesting. Well, I've learned about insulin euglycemia therapy. Lipid emulsion is considered after HIE or when the agent is highly lipophilic. The patient is peri-arrest. Transvenous pacing often fails in these because the myocardium is too depressed to respond. Sodium bicarb is helpful for a pure sodium channel blockade, but will not correct profound inotropy and vasodilation driving the shock here. Give only if QRS widens further after HIE is started. Well, it did wonderfully teach me about the wonders of high insulin euglycemia therapy. Isn't that great? I learned about oxytocin, I learned about mag sulfate, I learned about glucagon. Now I've learned about HIE, high insulin euglycemia therapy. You know what I haven't learned about though is these sheep. Did something extinct everything? Just a bad day for sheep. I almost walked right to my death. Let's not jump off the cliff here and just find a sheep. There were a bunch on top here. If there are none on top of this hill, that's how you know something has happened. And I don't really see Minecraft worlds as being capable of having that kind of variability. But I guess it's possible that they could have just despawned. I hope not, because that's kind of it's sad, right? I was like, all right, guys, I'll see you later. Yeah, there we go. There's my buds. And bees. Hey, guys. What you doing? Thank you. Thank you. Enjoy the haircut. It was free. Cool. Alright, that's 6. So that's 2 beds worth of wool. I cannot shear you, my cows. Do you guys know where any other sheep are? Because I surely am looking for some. I see a pig off to my left. More bees. Morbius. Okay, well, I guess we're coming up short on sheep here. And there's that one village. It's got its own villagers. Isn't that cool? They're just over there doing their own thing, huh? Cows. No sheep, just this weird pig. Just this very strange, off-putting pig here. Another. What did you guys do to all the sheep? Ow. Hello. They're like, yeah, we're actually super happy you cannot shear us. So it seems like a weird experience. Funny that there are more pigs in the forest than sheep, I guess. Alright. No, over here. Okay. Another. Oh, it doesn't know any other styles. Let's go ahead and check this. Give me a... It's going to take it a while to think about that. Well, I got enough for 2 beds. That's a small victory, right? Hey, what's up, freeloaders? Yeah, you guys having fun? I'm running out of space. I need a storage room. Maybe I could just put him outside. Maybe that's something I could do. Check it out. There we go. Just random stuff. Yay. Oh my god, they do not. I'm about to just get rid of the door in my house. I'll be honest with you. There y'all go. Is that better? Oh, it is better. Oh, that's so much better. 24-year-old woman, history of severe asthma, was found sitting upright, struggling to breathe. She has already received 2 albuterol Duanibs and Epi. She's got asthma. Okay. Mental status increasingly confused and drowsy. She's got low, sort of normal respiration, shallow with poor chest rise. Lung sounds markedly diminished bilaterally, almost no wheezing. SpO2 is 89% despite high flow. Her end tidal is super high, pronounced obstructive waveform. Pulse is 138, blood pressure is 104/68. 138. Which intervention is highest priority? Brother, she's already had the fucking epi, huh? Yeah. Let's go ahead and do, let's see. Maybe? She's not doing too bad, but what was the other option? You could do CPAP. No, I don't think CPAP is. Maybe. But she's got a restricted airway there. Hey, bud, do you know where there's any more, sheepers? I don't know why I keep calling them sheepers. It just sounds fun. Give me that egg. How are you guys not sheep? Do the sheep keep dying in the lava, maybe? Still no sheep. I want to make a building with at least 3 beds, so I'm going to need a little more wool. Come here, sheepy. I'm going to shear you. Goodness, there's so much lava. They probably did all die. They've got to change the... Sorry, I just heard a real life noise. I don't know where this real life noise came from. You guys got any sheep over here? What are those, pigs? Guys are kind of weird. Can't shear him. Can't shear... A bunny. Bunny. He's freaking out, man. The bunny fell to its death. What? Oh, I think someone was chasing it. Hey, they got the cool little berry bushes over here. That means I can grow a bunch of my own, and then you can use them for, what do you call it? Use them for bone meal. That's always fun. Okay, found a black sheep, found a black sheep. Sorry, bud. Okay. I'm in the other village making first contact. Hello, everybody. A small baby. Okay. Spruce saplings. Y'all are kind of weird, man. Hey, this is a cool house concept. So it's, what is it, like a, oh, that's neat. You got the fence with the, oh, it's a dual trapdoor? Yeah, I guess so. What are the dimensions here? Oh, that's so neat. Okay, I see now. I should probably take advantage of one of these houses, huh? Sorry, but I have to sleep here. Okay. Correct. C. Assist ventilations. We got it right. Magnesium may improve bronchospasm, does not immediately correct failing ventilation. Additional epinephrine and albuterol may be adjuncts. Patient is too fatigued to wait for them. CPAP requires adequate spontaneous respiratory effort cooperation as patients becoming drowsy and hypoventilating. Give me another one, smart ChatGPT. No job. You have no job. Thus, nothing to offer. How do you guys stay alive? Oh my goodness. What the? Yeah, you guys are definitely at risk of just dying from going down there. I'm be honest, I don't understand how there are any of you alive. Okay, this is all fun and good. I just saw another sheep up there, and that is my main mission. After that, just go home. Well, it was fun to see you guys. I met a small, tiny baby. I kicked a man out of his own bed, slept in it while he watched me. Let's go back up here. Get this Mr. Sheep and get his wool. Thank you for all that. Thank you for all that. I like that it gives them sideburns. You guys got some crazy formations coming on over here. Okay. Well, that my place is over here. What is that? It's a fox. Hey, bud. I'm just gonna head back to my place. I now have enough for 3 beds. Oh, I didn't realize that shears could just take the leaves from something. That's really interesting. I forgot about that. I could just take those leaves as well? I didn't realize. I now understand the power of shears. I command the leaves. I wonder what the new question is. A wolf. I totally forgot there's a massive cave right there. Okay, last question. A 37-year-old woman is found confused bedside empty bottle of aspirin. How do I get it to start thinking again? I accidentally stopped it from thinking. I didn't. I didn't mean to. B. It's going to be like B is the second letter of the alphabet. B comes after A. A being the first letter of the alphabet. Okay, the tree grew, and it's absolutely enormous. It's got more leaves than any tree I've ever seen in my whole life. Alright, where's my cool expert? Whoa! I can get chiseled stone bricks now. Thank you. I can get chiseled stone bricks from my mason man. That's cool. Are you my... There's my goats, man. Or my fellas. Hey, I can get golden carrots now. Give me... I've got 2 of these. Give me 8 pumpkin pies, please, actually. Thank you. Okay, B was correct. Administer sodium bicarb. This is severe salicylate toxicity, tinnitus, hyperthermia, deep tachypnea, low end tidal, and worsening mental status. Her hyperventilation is protective. It maintains respiratory alkalosis, limiting salicylate movement into the CNS. Sodium bicarb supports serum alkalemia and urinary alkalinization, increasing salicylate elimination. Why A is dangerous. Intubating and ventilating at only 10 breaths a minute would sharply reduce her minute ventilation, raise arterial CO2, lower serum pH, and rapidly increase the CNS salicylate penetration. Intubation should be avoided unless essential. She's hyperventilating for a reason. Cool. Alright. I learned about salicylates earlier. I've gotten a couple of these wrong, but it's only because it's stuff I'd literally never heard of and never encountered in the field. I was kind of hoping these would be harder. I know that there are actual NREMT questions that are more difficult. It doesn't want to give them to me. Hey y'all, if you guys don't mind, I'm actually about to make some little beds. About to make beds for the children. What? 3 beds. 4 beds, actually. Okay. Well, we're going to make the big old bed house now. I'm going to put all my doohickeys in here that I don't need. Get our huge amount of spruce logs. And we will do our first expansion. This seems like a pretty good area. So to fit this many beds, so what it would be like 1 space 1 space 1 space 1. Oh, I guess we do 1 space 1 space 1 space 1 space. Well, if that one's up against the wall, we need 1 more space, huh? One, 2, 3, 4, 5, 6, 7, 8, 9, and it's offset completely. I messed it up already. Oh my goodness. We're not doing too hot here. Now we are doing good. We'll put this one not quite at the limit. Okay. Well, let's make some dadgum. Let's make some house. I can make it snazzy later. One, two, three, four. Oh my god, they're making another baby. They're making more babies. Y'all, I ain't got the fuck. Y'all, we're gonna have way too many people, man. That's a lot of babies. I'm not that good at building homes. Y'all gotta stop making love over there. This is bad. Beds. I hear the little babies. Don't we have a wonderful little village? Everyone's got a bed. That's so good. Alright. What I'm also going to do in this building, it looks like a Dollar General. Goodness gracious. What was I about to do? This right here. I've got to make the floor. I don't know if that's going to be enough, but no. This is great. Alright, now that we've done that, let's do the math here. Let's figure out if this is enough. 1, 2, 3, 4, 5 times, what is it, 9? Yeah, we should have just enough. I'm having fun. And I think we have another question waiting for us, huh? No, we don't. That was the last question, wasn't it? Alright, well, let's finish this up and then we'll cut this video. Yeah, no one has to know. Okay. Alright, would you guys look at that? This is pretty great right here. Let me give you a window, 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 window. Oh, I have accidentally backpedaled into a massive hole. This is cool. You know what it needs now? A roof. I could be doing this procedurally, but I'm not a procedural person, as you can tell. Okay, well, enough for one of these, and then let's go ahead and make a bunch of these, and then look up fence. Nine of those, and then what was it? Were they trapdoors? Okay, it was. Cool. We'll do this then. Spruce trapdoor. Alright. I like the corner table. Nice! I made a table. That's cool. Oh. I see now, I see. That's the only way to get it to look like that. That's really cool. It's like a work table. Right here in the middle. It's not... I should make it one longer so that it feels like a dinner table, maybe. Yeah, that's pretty neat. Alright. Plenty of lighting. Do I have any slabs left over for maybe an overhang? I like it. Picasso. I like to make it a little irregular. Make it look kind of cool. Nice. What a house. What a beautiful house. Look at that. Gorgeous. We now have a true expansion for the villagers. That's awesome. Now I can get pumpkin pie. I'm going to axe these pumpkins. Alright, well thank you for watching. I hope you guys learned something about uterine atony and about glucagon as a thingamajig. High insulin euglycemia therapy. Can you not control F a ChatGPT conversation? I was trying to figure out where the glucagon was. That's right. First line of beta blocker overdose. Okay, well, look at that, already growing. What about the other ones?